Hello everyone, I am Dr. Mustafa Mahmoud. Our video today about intermittent fasting. By the end of this video, we will understand the mechanism by which intermittent fasting triggers fat burning, methods and benefits of intermittent fasting, and also potential side effects and limitations of intermittent fasting. What is intermittent fasting? Intermittent fasting is a way of feeding when persons voluntarily time-based restrict energy intake to alternate between periods of eating and periods of fasting or reduced calorie intake. Physiology of intermittent fasting. Beyond 12 hours of cessation of food intake, a process of negative energy balance is initiated, at which a metabolic switch occurs where body utilizes fatty acid-derived ketone bodies instead of glucose as a source of energy. Intermittent fasting depletes glycogen stores in liver and skeletal muscle cells. As a result, glucose levels is reduced. The low glucose level creates a low insulin state that leads to upregulation of ketogenic pathway to induce fatty acid release from adipose tissue, which increase the rate of beta oxidation of fatty acids in liver cells, and finally increased production of ketone bodies such as acetoacetate, beta hydroxybutyrate, and acetone from liver cells. And the mitochondria of extrahepatic tissues as skeletal muscles, brain, and heart. Ketone bodies such as beta-hydroxybutyrate and acetoacetate are metabolized to acetyl coenzyme A. The acetyl coenzyme A is subsequently metabolized in Krebs cycle to generate ATP molecules, which provide energy to living cells. Each molecule of beta-hydroxybutyrate will generate 27 ATPs, while each molecule of acetoacetate will generate 24 ATPs. Types of intermittent fasting. There are several methods of intermittent fasting can suit each individual according to own preferences. Some of the common ones include alternate day fasting that involves fasting for 24 hours every other day. Second method is the weekly one-day fasting that involves fasting for 1 day each week. Third method is the 16 to 8 method, which involves fasting for 16 hours while eating the remaining 8 hours of the day. During the fasting periods, it is still allowed to drink water and other non-caloric beverages like tea and coffee. The fourth method is the 5 to 2 method, which involves eating normally healthy food for 5 days per week, then restrict calorie intake between 500 to 600 calories per day of the remaining 2 days of the week. The fifth method is the eat to stop eat method that entails fasting for 2 days per week. Ideally should be spaced while eating normally the other 5 days of the week. And finally is the B2 regimen, which entails fasting for 14 hours daily, ideally through consuming 2 meals per day, breakfast between 6 and 10 a.m., while lunch between 12 and 4 p.m. without any dinner. Benefits of intermittent fasting. Intermittent fasting appears to be effective for weight loss in obese patients. 4 to 24 weeks of intermittent fasting induces body weight reduction of 4 to 10%. The basic mechanism of weight loss by intermittent fasting involves reduced calorie intake, fat mobilization during metabolic switch, and finally, the low insulin state. The effect of intermittent fasting on glucose metabolism and insulin sensitivity is influenced by the underlying disease condition. In those patients with obesity, type 2 diabetes, or metabolic syndrome, hemoglobin A1C, insulin levels, and hemostatic model assessment for insulin resistance are reduced. While on the other hand, in non-diabetic, non-obese patients, the effect was non-significant. On hypertension, intermittent fasting has positive impact on blood pressure, with reduction of systolic and diastolic blood pressure. Intermittent fasting through reducing leptin levels and enhancing beta oxidation of fatty acids resulted in reducing triglycerides, low density lipoprotein, and very low density lipoprotein levels, with improved high density lipoprotein levels, thereby reducing the risk of atherosclerotic disease. Intermittent fasting is not for everyone. There are potential side effects and limitations of that eating style. Such side effects like bad breath, hunger, fatigue, headaches, mood change, and dehydration. While those who are type 1 diabetic, pregnant, frail older adults, or those with eating disorder should avoid intermittent fasting. Here we come to the end of our video. I hope it was helpful. Till we meet again with the next video. Thank you and goodbye.